Welcome to another episode of the brand called You, a podcast and podcast show that brings you leadership lessons, knowledge, experience, and wisdom from thousands of successful individuals from around the world. I'm your host, Ashutosh Garg, and today I'm not only delighted but privileged to welcome a very, very distinguished and well-known medical professional, a doctor from Bangkok, Thailand, Professor Kris Chatamra. Professor Chatamra, welcome to the show.
Very kind. Thank you. Good morning.
Thank you. Professor Chatamra is the director of the Queen Sirikit Centre for Breast Cancer, or QSCBC, and the foundation. He's an MBBS from London, an FRCS from UK, and an MD from London. He's recognized, given the kind of work that he's been doing, he's been recognized, awarded, and felicitated several times. So, Kris, let me start by asking you, what inspired your journey into medicine, and why did you choose surgery as a specialization?
That takes me back over half a century, Ash. As you know very well, the Asian culture, even half a century ago, the professions that the parents want you to go into would be medicine at the top of the list. Originally, when I was at boarding school in the UK, I really wanted to do PPE or something to do with law and economic and philosophy. I enjoy that. But my father said, look, have a go to medicine. If you can't do it, then, do something else. So I did have a go, and I applied to a medical school in the UK, and they gave me a place. That's how I got started. And now, how I got into surgery, that's, again, it's almost a funny story. When you just qualified, you look at your teachers, and the people who struck me then as having more go than other branches would be the surgeons. So that's how I got started. It's simple as that. There's nothing inspiring or anything more complicated than that. It's just a simple young man, young boy picture of the world.
Well, and as they say, the rest is history. But, you were in the UK, you studied there, you did your medicine there, and then you chose to move back to Thailand after a very successful medical career. What were the reasons to move back home?
Again, another very odd story. I was then quite well established in the UK. Yeah, I was senior lecturer. I was consultant surgeon. I was at the time examiner for the English FRCS. And then some old friends invited me and another English friend of mine to come and give a talk in Bangkok. And I looked around and I thought to myself, after I'd been away for over 30 years, I said, look, there's an awful lot of opportunity here. And at the same time, in the UK, the health service was going through some difficult time. And there's one word which wasn't used normally in reference to the service, was quality. Everything was good returns of investment, all that thing. So that's what really got started. And this friend of mine said, look, would you be interested to come here? And it was my wife, Queen Sirikit. I said to her, look, do you think you can live in Thailand? You know what she said to me? She said, I can, but can you? That's how I got started. So
yes.
I came, and the rest is history. I've enjoyed it. It was the first 3 years was very, very challenging. Looking back, you and I can have a bottle of wine and talk for hours.
Correct.
How I managed to get along.
I know. When I come back, when I meet you, I'll tell you we did something similar after many years in Singapore. We moved back to Delhi, but that's another story. But tell me, how did your time at the Royal Marsden Hospital shape your perspective on cancer care?
Well, I was lucky to have the position of a lecturer at the Royal Marsden. It's the position which you're not that senior, but you're also not that junior, and you were able to be involved with all the branches of cancer at the time. We had to organize meeting things to deal with visitors and people who want to come and see what we did. So I've learned a lot. And the thing which I've learned from the Marsden is that the most important people are the patients.
Correct.
I think a lot, and you may be surprised for me to say this, a lot of doctors, not just in Thailand or in India, but European as well. After a while, they forget that the center of attention is not the doctors.
Correct. It's the patient.
It's the patient. Don't forget that.
Absolutely.
And at the Marsden, I was able to see patients from all sorts of life, and of course, most of them had cancer. And the first year was it required a bit of adjustment. But after a while, learn how to deal with it and also how to protect yourself. I used to protect myself because if you're not careful, you're going to be involved with their problem. At the end of the day, you're going to lose yourself, and you can't treat them. That's how I was there for over 3 years. So it was a good time for me to set myself. Let's put it
very well said. Great response. And how did Her Majesty, the Queen Sirikit's patronage, influence your journey and the development of the center?
Ash, that's a very big story. Can I just make it short that I was fortunate enough to be asked to look after Her Majesty. And therefore, I was invited to see the work she was doing. And it was an eye-opener because what I saw was firsthand, and I could see that Her Majesty's work was very hard. But I never heard Her Majesty complaining once. And some of the conditions that she was willing to cope with was almost beyond me. I mean, I have a story I can tell you. It's unbelievable. But the main theme I could get from her work was that she was totally dedicated to the well-being of the Thai people, without any selfish thought at all. I mean, most people think that kings and queens have a lovely time, but I tell you, seeing her work and being there, seeing firsthand, it was hard. But the front may be easy, but the background was hard work. And I've learned a lot from Her Majesty's work and her attitude toward work. I've learned a lot.
Amazing.
It actually shaped what we plan to do later on.
Correct. But moving on, Kris, you brought in a multidisciplinary patient-centered model in the early 1990s. What was the inspiration of this methodology that you brought in?
Well, I don't think it's inspiration. You've given me too much credit.
Okay.
It's learning. My time at the Royal Marsden in London gave me a lot of ideas, and you could see from the early 90s. I was there in the 80s. I got back to Thailand in 1990, but I could see that the treatment of breast cancer, which is quite different from other types of cancer, does not rely on one single line of treatment. It requires multidisciplinary approach. And that's what I predicted it's going to come. When I first came back to Thailand in 1990, the treatment of breast cancer was essentially removing The breast cancer was awful.
Yeah.
So we introduced the multidisciplinary treatment for breast. We established in Thailand and in almost the same time as any other leading center in the world. So that's how I got started. But we've been lucky because what we predicted worked out to be just the job.
Amazing.
That's how I got started.
Amazing. And let's talk a little bit about the area of your specialization, which is breast cancer. What are some of the main challenges facing treatment of breast cancer in Southeast Asia and in Asia?
Actually, that's a very deep question. And I need to just go around a bit. I think you and I probably recognize this more than people coming from North America or from Europe. I think the first thing is that the culture of Asian women,
correct,
basically is different from European North America.
Yeah.
They somehow regard, or you did then, that some people thought having breast cancer was something that they've done something bad in the past, and they're going to suffer it.
Yeah.
So therefore, there's nothing, you can't get away from it. Some people regard it as something almost dirty, and they do not want to talk about it. So I think deep down, that's what I found that the basic problem when I first came back here. Of course, the education, the overall education is different. I mean, I was used in the UK that people talk openly about what they knew and what their friends knew about breast cancer. So therefore, the level of true fact and knowledge was higher, and of course, it like easier for people like me to treat. And of course, the third thing, of course, is that treating breast cancer is not cheap.
Right.
And overall, the level of financial support for the average Asian women is lower than European North America. So
Correct.
these are the basic things which I found that was challenging. Therefore, because to educate them, that's how we got involved we introduced the first time in this country the early detection program, which I had to thank my wife Queen Sirikit for starting it. And it's been going on for nearly 20 years.
Amazing.
It's an attempt to educate the masses, the average Thai women.
So tell me a little bit more about the emphasis that you have placed on early detection and awareness.
Well, what we've done is we look around to see how we could approach it. Most women, they couldn't be bothered to go and read small print. But what most people would be attracted to would be a picture of somebody they recognize. We usually are sort of film star, TV star, or people in the news.
Yeah.
So we approach these people, explain what you want to do. We then selected the most well-known photographer in Thailand to do the photography. We invited these well-known people for formal studio photographs, lots of them. And I must admit that we've been very lucky. They all contributed without asking for any returns. And then I supplied my wife with information about breast cancer in the technical terms. So make sure that everything is correct.
Yeah.
My wife then converted the technical medical terms into the normal Anglo-Saxon simple English. On every page, there's a lovely picture, beautifully photographed, and by the side, there's information about breast cancer.
Wow.
There are lots of these. So when you look through, when you see these pictures, you automatically see the information. It's almost learning by osmosis.
Amazing.
When I see you in November, I would love to present you with one of these books.
I would love to look at it.
And that's how we started doing it. And when we went, but my wife have a slum project that we take our team, doctors and nursing staff into the underprivileged areas. I hate the word slum.
Amazing.
And we teach them about breast cancer, about cervical cancer, and then we select suitable people to come to our center. So we send big bus in a week later, bring to our center, including their children, their family as well. So we look after for the whole day, and we give them medical examination, ultrasound, mammography, cervical smear, and look after and feed them all day, and then we take them back. That's how we've been doing it for the last 5 years.
Amazing.
So and anybody who pick up with cancer, we keep.
This is such an amazing example or story of democratization of knowledge about breast cancer. Thank you. You also have established a tumor bank and genome profiling. Tell me a little bit more, and why was it so important?
Yeah. Again, this is to look toward the future. For what I've been noticing that the last 25 years or so, the biological progress, information we get about breast cancer and also other cancer too, it multiplies tenfold every 2-3 years, and there's always another new test coming up. Now, what problems you had in the past? I love to do this test on this particular patient, but we have no tissue left. So what we're trying to do is every new breast cancer patient that comes through us, we take a small piece and we put our tumor bank at minus 180 degrees centigrade. It can be kept forever. Anything new that is useful for that particular patient, we can always do. And also anything new that we think going to be useful for other patients for the present and the future, we can always do.
Yeah.
So this is how I visualized it. And of course, as you know very well now, the treatment of breast cancer, particularly more so than any other type of cancer, is that it's not just surgery, chemotherapy, irradiation anymore. You have to go deep. And we have been at our center very, very active in introducing the immunotherapy, which is treating breast cancer using immunotherapy. We've been quietly doing behind the scene, and that's another story you and I can talk about.
Yeah.
My is that I hope that I'm right, is that the ultimate cure of cancer, it's got to go through our own defense system, which is the immune system.
Correct.
I mean, you think that cancer is common. Cancer is very rare.
Yeah.
And the reason why it's rare is because your own defense system, your own immune system, had taken care of it for the last 2 billion years. So why don't we make good use of it?
Absolutely.
That's another story.
Absolutely. What a great response. Thank you. The next few questions, Kris, are for you, not the work that you're doing. How do you manage emotional resilience when working with terminal patients and families?
Gee, nobody's asked me this before. It's almost, I think I have to thank my my boss back in the UK, who once said to me, he said, Kris, you must not build a wall or your empathy for your patient is going to be lost. At the same time, you must not lose yourself into the emotional response. He said, otherwise you will run out of steam. Remember his advice to me. So what I've been doing is that you of course you must have empathy with your patient, but there is a line you mustn't cross. That's how I sort of trained myself. And being at the Marsden helped. We've also built in Thailand a place just outside Bangkok. I have a large piece of land given to me by a lovely patient. We built the first hospice center in this country.
Amazing, amazing.
And we built it not just a place for people to go and wait to die. We built it so that people can be. These were the poor people. You know, they've been poor all their lives, and before they pass away, we want them to have. Let's put it rather dramatically. We'd like them to go up to heaven before they die. Absolutely. So it's a place where they can be looked after. There's an individual room. There's a balcony. They can see landscape, a garden. And in the morning, one of the nurses come to see her. Say, "Look, you want to sit outside or do you want to be indoors?" Treat them like your relative.
Correct.
Till they pass away. We built that, and it's about to be opened. Amazing. So that's. I hope that answers your question. Instead of trying to be involved, I rather build things so that I can have a focus.
Such a noble thing you're doing.
No.
Yeah.
No, not so. It's not a noble thing. It's something that I can see. It should happen.
I agree. That I agree with you.
So to get on to do it.
Yes, I agree. You also you awarded many times, but I want to ask you about two specific awards. One is the Buckstone Brown Award, and the second is the Cutler's Awards. Tell me about these awards and what did they mean to you?
Well, first, the Buckstone Brown is a very odd award. It's awarded by the Harveyan Medical Society of London. As you know, it formed after William Harvey, who was the father, or you have to give him the credit of the discoverer of the cardiovascular system over 400 years ago. And the society was founded after him. There's a big statue of him in Folkestone, of William Harvey. Now, this award was given every 3 years, and the person must be medically qualified and must not be below the age of 40. So I was given an award a long time ago, and it was supposed to be on a piece of work, research or clinical work that the committee thought had potential usefulness for clinical practice, and it should be something of pioneering. That was the condition. It was quite broad, and I was, of course, I was very delighted and pleased, because the people before me were highly distinguished people, like Professor Sheila Sherlock, who was the world's liver expert, and I was working on my MD thesis on liver cell regeneration. I was delighted that the committee thought that what I was doing was what had potential.
Absolutely.
But a long time ago, I wasn't even 40 then.
Amazing. And the Cutler's Award?
Well, that was a bit later on. I was then a senior lecturer at the Royal College of Surgeons of England, ran my own lab and things, and the council gave me that award. It was an annual award, founded by the Cutler Society of London, and given to the Royal College to select the person. And it was I was working then on how the body responds to different types of clinical problem, like trauma, jaundice. I was working on the amino acid metabolism under these conditions, and they thought that it was useful enough to give me the award.
Amazing. I have time for two more questions for you, Kris. You do your work entirely on an honorary basis. What role has your family or your upbringing played in shaping your commitment to service?
Well, again, I got to thank my mentor, Professor Peter Daniel, who said to me, he said, I hope in the future, Kris, you will be in the position to do important projects. He said, and my suggestion to you, he said, was that do not accept a salary. So I asked him, hang on, why? He said, if you do not have a salary, if you go and see, say, a multimillionaire to talk to the person, the people about a project which is useful for the public, say, you go in there as an honorary person. You have ideas. They have the money. You sit at the same level. If you go there as a salaried person, you go there as an employee.
Correct.
Is that you sit on a low level? Believe me, it makes a big difference psychologically. And do you know what? Ash, he was absolutely right. I mean, the reason how I built the center, how I built the hospice center, was literally I went to see 2-3 people. They're lovely people with wealthy. I went in there with no money, but just ideas. And that's how we built. If I were to go there as somebody who was under salary, I would go there as under instruction for somebody else. And Professor Daniel, 30 odd years ago, absolutely right.
Absolutely.
That's how I've done things.
Yeah. No, you're right. Professor Daniel was right for you. And I think what you have just said is going to be right for the thousands and thousands of people who will listen to our conversation. Very wise advice.
You can have people ask you, well, how do I live? Well, 4 o'clock in the afternoon, I quietly go to the private hospital and earn money there. That's how I do it.
Absolutely right. And that has to be done. But my last question for you, Kris, as you look ahead, what is your vision for the future of the Queen Sirikit Centre for Breast Cancer in Thailand?
I wish you hadn't asked me that.
Okay.
Look, when Queen Sirikit, Queen Mother, when I said to her 25 years ago, up in the north, I had the opportunity to say, so I said to Her Majesty, look, I would love to build a breast cancer center of the highest quality that would on par with the best of European North America. Without any hesitation, Her Majesty turned around to me and she said, I like the idea. I'd like it to be a sanctuary for women in need. Just like that. So 4 years later, with a lot of help from Her Majesty, we opened the center. She opened it. Then it was the most modern center in Thailand. After now 20 years, I think at the moment it's the best center in the region.
I can imagine.
Okay.
I can imagine.
And Her Majesty wish sanctuary for women in need. That's very deep. It really, to answer your question, I want the center to grow and be a sanctuary for women. It doesn't have to be for Thai women. Be for women who seek help.
Correct.
That's my real vision of how I want the Queen Sirikit Centre to be. And amazing. I hope it's going to be a sanctuary for women who need and seek help beyond what they are given. It doesn't have to be Thai. It has to be if people from India or in any country,
anywhere in the world,
when they come to us. That's how I would visualize.
Absolutely.
That's how I like it, and that would serve Her Majesty's original wish.
Absolutely. And on that note, Kris, and the amazing words that you have told me about the vision of Her Majesty Queen Sirikit, and all the efforts and your vision. Thank you so much for speaking to me about your own incredible journey. Thank you for speaking to me about the revolution that you have brought into breast cancer in your country, and as with that in so many other countries that around Thailand. Thank you also for the amazing work that
thank
you are
you very
doing.
much indeed. Look forward to seeing you when you drop in.
I look forward to that myself. Thank you again.
I've enjoyed it.
Thank you. Thank you for listening to the Brand Called You videocast and podcast, a platform that brings you knowledge, experience, and wisdom of hundreds of successful individuals from around the world. Do visit our website www.tbcy.in to watch and listen to the stories of many more individuals. You can also follow us on YouTube, Facebook, Instagram, and Twitter. Just search for the Brand Called You.